Okay.
Okay, let me present. Just present full screen. Here we go. Okay, so today what we're gonna do is last week we did 2 weeks ago, we worked on we started a case study of somebody that we were going to take through all the stages of kind of how I do play therapy or work with kids and teens. And this is just one way that I've worked with them. So, but I like this. I think this has helped me a lot, knowing like having a track, having like a model to work out of. And so I said it's really important to know kind of where you're going from the beginning when you're working with kids and teens. So last week, I talked about the first stage of play therapy that I do, which is just building a relationship, getting to know the child, making sure that they feel safe and feel like they can, share things with you. And so today we're going to talk about learning about the child's inner world and like how they interact with people in their life. So it's going to be exploring their interpersonal world. And I'm going to give you a lot of like just practical interventions you can do. And a lot of them you can use for a lot of ages, even adults too. If you have an adult that likes doing more like crafty things or likes making things, this is a great way to do it. So this was our case study, and her name was Maria. She's 9. Her parents are bringing her in, and Maria just has a really bad fear of throwing up, to the point where she'll just work herself up and she actually will throw up. And so this really happens at nighttime before she goes to bed. And so she's, besides this area, she's a really well-adjusted girl. And this is just a concern she has. So in this next stage of play therapy, I'm just going to want to get to know her a little bit more, her world, how she thinks. So the first part is the interpersonal world. So this is just how a person interacts with other people. And so with adults, usually what you would do is you would take them to the expo board and you would draw out a genogram, or you would just write out the genogram in their notes after asking them questions. And there are different ways you can do that with kids. I use these really often. Um, usually, usually the stage starts happening about the 4th or 5th session. Usually by then the child feels safe and comfortable and they're starting to talk to me about things. And so this is when I'm going to get to know their world. So I usually do a genogram, but these are the ways that I do them. I've also done these with teens too, especially the sand tray one. So what I would do with the sand tray genogram is I've done a few different things. I've gotten the dolls from the dollhouse or animals, or I tell them any object in the room that you feel like represents somebody in your family, you can use it. So I've had kids, they go to the sand tray and I tell them just make a picture with these objects of your family or who's in your family, who's in your life. And so I've had kids go and get like the basketball to represent themselves, or like the dog to represent mom because that's mom's favorite animal. So it doesn't really matter what objects they use, but it'll give you just an insight into the people in their life. And I'm watching for things. I'm watching where they're putting themselves in this picture. Who are they closest to? And so then once they put all the objects down, I'll ask them, is there anything you wish was different? Would you move anything if you could? And so sometimes they'll say like, oh, I wish I was closer to my brother. I wish we didn't fight as much. I wish we'd get along. So it gives you an insight into that. I've also done this before parent meetings. Sometimes I'll have the child make theirs the week before. I'll take a picture, I'll bring it in and show them, and then I'll have the parents make their own sand tray genograms in the sand too. And it's a fun way for them to get to kind of experience what the child's doing in the session. And also I get to learn about the mom or dad's perspective of their family as well. So the next one that is a really common one I do is called the kinetic family drawing. And basically all this is I tell them, draw me a picture of your family, but everyone has to be doing something. So, and I don't give them examples unless they're really confused, but so everyone in the family has to be moving, doing an action. So it could be like dad is like mowing the lawn, or I'm drawing mom and she's cooking something, or drawing my sister and she's making a mess somewhere. So you're just learning kind of things that their family likes to do, how they see their family. The next one is similar. It's also a drawing one, but it's drawing all the members of your family, and you color code them based on the emotion they feel the most. So before I'd have them draw, we'd come up with their own key. Like I write down maybe 4 basic emotions like sadness, happiness, anger, disgust or confusion, something for the 4th one. And then they'll pick the color that goes with each of those emotions. So say they chose blue for sadness and they draw mom blue. So that lets me know. Then I ask them more questions based on that. Man, what makes mom sad? What is she like when she's sad? Or why is dad red? What makes him angry? How do you experience him angry? So that's just letting me know maybe what emotions are going on in the house that they experience each parent. And I've learned a lot from this one. It's really insightful. So, and kids usually like doing it. And then the last one I will do usually for genograms is just bringing them to the dollhouse, especially if it's a younger child, like 6 or 7 and younger. I just set out dolls and animals around the dollhouse, and I just say, can you show me what it's like maybe at home with your family? Or I've done this if I've had concerns for any abuse, or I'm so sorry, my dog is barking. Somebody was just at her door, so I'm sorry if you can hear her. But this is just a great way to get to know the child, and you can watch them act out some things, especially if you're still not really sure about the family dynamic. It gives you a big insight. So those are my main ones. And what I usually do is I will just pick one for the day. Every child's so different. You may have a kid take the whole 45 minutes of their session just drawing their picture. And you may have kids speed through it in like 5 minutes and they're done. So it also lets you get to know the child, how they work, if they like to take their time, if they're perfectionistic. So you're watching for all those things too. Again, you're still really in the assessment phase, getting to learn about them. And then if they're a fast finisher, if they only take like 5-10 minutes and then they're ready to go do something else, you can, depending on the age, with younger kids, I'll do like free play, and I'll just do like child-centered therapy with them. Or if it's a teen or an older child, then you'll just have them pick a game, or you can say, you can draw something else, you can draw anything else you'd want, or we can just play a board game. So that's ideas for when you're done with one of these activities. So that is learning about the child's family, their interpersonal world. So now these are activities to learn more about the child's interpersonal world. So this is how they think about themselves, what goes on in their mind. These are their emotional patterns, their cognitive patterns, their self-image, how they feel about themselves, how self-aware they are, their strengths, their weaknesses. These are all those things. You get to learn a lot. And this is one of my favorite stages with kids and teens, because it really brings them into making changes once you learn more about themselves. And so these are ones that I've done. I've done these with 5-year-olds all the way up to like 15-year-olds. So these are really great for a lot of ages too. So the first one is one that I do with almost every child I work with. So it's called I am, I'm not, and I wish I was. I've done this different ways. I have my own like cards. They're called, I can't think of the name, but I'll find the name and I'll send those out. And they're basically just like affirmation cards, and they have pictures on them. I use this with younger kids. So it'll say things like, I am kind, I am intelligent. And then it has a description of that word on the back. So if they're not really sure what that word means, you can give them an example. And so then what I have is I'll have 3 piles. I'll have an I am pile. I just write it out on like a piece of paper or a sticky note of I am, I'm not, or I wish I was. And then we go through them together and they sort them in the piles that they feel like represents them or best describes how they feel. So they may say, I am not I'm not lovable, or I wish I was more careful, or I wish I was more kind. So you learn a lot about how they feel about themselves. With teens or older kids, sometimes I do use the cards because they're just already made, and they are really great descriptive cards. There's a lot of them. Or sometimes I have, before I got those cards, I would just write out different characteristics on sticky notes, and then they would sort those. So I've said like, I'm a good person, I'm a good friend. So you have like both good and bad characteristics, because you really want to get to understand how they're feeling about themselves. And then we'll just reflect on it. If I have any concerns, I'll be curious about the ones that I don't want to pay a lot of attention to the I am not. I document those, I have them, but I don't want in front of the child to be like, oh, you're not this, or I really want to emphasize the positive things with them. So I am, really reflecting, oh yeah, you think you are really strong, like that is huge, or man, you want to get better at this. So that's just kind of how I frame that with them. But of course, I'm documenting what they don't feel like they are. And this also is a great assessment. It's a great baseline for you to have things to work off of. You can do this at the beginning when you're working with a child. And then when you feel like you're ready to terminate, this could be a cool activity to go back and see where you feel like they've made progress in their self-image. The next one is called person picture apple tree. Picture person apple tree, however you want to say it. Basically, all I give them is draw me a picture of a person and an apple tree. That's all I give them. I use scented markers because I think that's what the original assessment calls for. It just makes it a little bit more sensory. They're able to kind of focus more. And so that's the only directive I give them, but you'll learn a lot from just how they draw the person with the apple tree. So things I'm looking for, how many apples are on those trees? Is it an abundance of apples? Do they feel like they have plenty? Or maybe there's only like 2 apples on that tree. Is the person struggling? Can the person reach? Can they get those apples? Are they innovative? Are they thinking of a way? Maybe they're standing on a stool, so they've thought of a way to get to the tree. Maybe they're just reaching, trying to get the apple, and they can't. So then you're kind of going to have them tell you the story of this person with the apple tree. I have given this to some kids. One kid who was from a household that was pretty turbulent, and the only direction I gave him was to draw the person with the apple tree. He drew a whole like scene, a battle scene of like an apple tree and then a banana tree, and the banana tree guy was trying to steal the apples, and the apple tree guy was like blowing up the banana tree. So I learned a lot about how he thinks and what's kind of going on. So it's very chaotic, it's very aggressive. So you'll notice these themes when you have them draw the picture. The next one is also a drawing prompt, and all it is a boat, storm, lighthouse. You say draw a boat, draw a storm, and draw a lighthouse. And then you have them tell the picture. It's really similar to the one before, just a different way to kind of gather that data. So, is the boat going to be safe? Are they close to the lighthouse? How bad is the storm? Do you think that the people are going to make it through? Or, you're just learning about maybe their resiliency. Do they feel like when they face crises, or are they equipped to get through them? So these are really fun ways to learn about that. And there's a lot of data and information about how these are really effective. So they're definitely not just drawing activities. You learn a lot from them. The next one, these are called Rory's Story Cubes. They are kind of like the ones before, except for they're cubes. I don't have them personally, but they are on my wish list. You can get them on Amazon. There's different theme packs, and all they're cubes with like different pictures on them. The child rolls the dice, and then they have to tell a story with the pictures that they got. So, and you tell them you want a beginning of a story, a middle, and an end. So you want to see how the story resolves, who's involved with the story. Are they able to follow directions? You can learn a lot from these things. And then story cards are kind of similar. I have these cards that I just bought them on the internet, and then it gave me a PDF file, and I printed these off and laminated them. They're just a bunch of different, they're like this big, and they have different images on them. of like kids at school, kids with families, kids getting in fights. And so based on these pictures, I've had them either sort them into 3 piles, like tell me about, put pictures down that remind you of school, put ones down that remind you of home, put one down that reminds you of something else, your friends, or so you can have different piles. And then based on what they're putting down, you can learn about their world a little bit more, what they think about school, how they think other people view them. Or you could also just give them all the story cards and you just tell them to tell you a story, beginning, middle, end, like the story cubes, but they're cards. And so I've done that before too, looking for if the story has a good resolution, if they're in the story, who they think represents them. So yeah, and I'm also asking that question with the person, apple tree, and the boat storm lighthouse. I asked them, I wonder if you're in the story, who would you be if you were in the picture? And with the person picture apple tree, the one kid that drew like the big war scene, I said, who would you be if you're in this picture? And he pointed to the guy that was dead with blood all over him at the bottom, which is really abnormal for a child at 9. Usually they're the ones that are strong and fighting, but that let me know he really had a low self-esteem. And he said, yeah, I would be the dead one in this picture. So these are some really cool ones to get to know the child's inner world. So I just gave you a bunch of ideas. I'm wondering if you have any questions, if there's a child that you're wanting to learn a little bit more about, if you want to know more about an intervention, honestly, anything that you would like to share. This is just kind of the next stage that I take kids through, and I just wanted to give you some examples that were practical for you to use. Next time we meet, we will talk about helping the child gain insight into, once you learn all of these things from these assessments and activities, then you're going to go into the stage of helping them be aware of those thoughts and things that you've learned. And then after that, you can help make the changes. So that's kind of where we're going from here. But yeah, I will just open this up to anybody if you have a question or something you'd like to know more about, or a case.
Yeah, that was an excellent job too. So one thing that I just want to point out, I know these techniques are used with kids, or these interventions are used with kids. Man, there's so much that you can do with adults on this too. Just like, what was the one where you said what you want to be, what you.
Yeah, I am. I'm not. I wish I was. Yeah.
Yeah, those things, you can use those with adults too. So just throwing that out there.
And I've used some of these with adults for sure.
Absolutely. We all have an inner child that needs to grow. Okay. So I'll let everybody answer or ask questions.
Okay, Natalie, I have a question.
Yeah, go for it.
Okay, so I wanted to first ask a little bit about the boat storm lighthouse intervention.
Okay, yeah.
Does that one include a person?
It doesn't have to.
Okay.
Usually they do. Usually they're going to draw people in the picture, but they don't have to have a person. But you could ask, like, where are there people on the boat? Do they feel safe? Like, you can ask if they don't draw people, but even if they do, you can ask those questions too. So, but they don't have to have people.
Okay. And then I'm sorry, go ahead.
No, go ahead, Camille. I'm sorry.
And then the other one, the I am not, I wish I was, are those cards, or is something we make?
Yeah, I've done both. So I bought these. They're called, like, I want to say affirmation cards or something. They're in an orange box, and I got them on Amazon, and I have them in my office in my tub at the church, but I cannot for the life of me think of what they're called right now. So I can bring those out and show you if you're there when I'm there. And yeah, I've also just gone online and I've searched up like characteristics for kids or teens, and then I'll just write those on sticky notes. So if if it's hard for you to think in that day, I've done that too. So just different strengths or qualities that you would want to get to know if they feel about themselves. So yeah, it's really flexible. And also for the boat store and lighthouse and picture the person with the apple tree, you can Google like a directive, like they have instructions on how to present that to the child because it is like a true assessment. So if you want to, if you're not sure exactly how to like give that to a child or talk them through it, there will be probably many different resources for you online to go through. And then it'll also say like what to look for. So
one thing that we can do, Natalie, is you and I do a recording of some interventions, tools that you use, things like that too. So we can do that.
yeah, of course. Yeah.
Absolutely. So the other part, when you were talking about the lighthouse or the in the boat and all that, and what are you looking for when they do say there are people in the boat? What are you looking for?
Yeah, I just want to know what they if there's going to be a resolution. Like it's usually this assessment is to give you an idea of, it's a reflection of them, you know, they're coming up with it. It lets you know how they think through problems is really, or adversities or conflict. So I'm wanting to know, like, are the people going to be safe? Like, do they, in their mind, do they feel like they are safe? Is there a resolution? Is, you know, is the storm going to completely shred the boat apart and they're not going to make it? So it just lets me know how they think they can get through things, because it really is a reflection of their inner world. So yeah, you learn a lot from it for sure. Even if it may not be them in the boat, it may be, oh no, that's not me, that's somebody else, or they may make up a name. Then I would learn they want to depersonalize. Maybe it's safer for them to create a new character rather than themselves doing it. So there's a lot of different ways you can interpret it.
Do you use any type of superhero interventions?
In the drawings,
Well, it could be drawings or, you know, like the I wish I was type thing.
yeah, I mean, superhero, like heroes, is a big common theme with kids. Sometimes it really comes out of like good versus evil theme is what I would characterize that as. So usually when kids are like either acting out that they're a superhero or drawing it, they're trying to understand, am I good or am I bad? Because kids are very black and white. It's hard for them. They don't understand that people can do bad things and be good, or also be bad and sometimes do good things. So they feel like I am either all good or I am either all bad. And so when they're playing out like rescuing somebody or somebody's the evil person, or drawing that out, it's really, they're trying to understand, make sense of it themselves through play, knowing that, you know, especially kids that have behavioral problems, they usually in their mind feel like I'm bad, like I'm a bad kid. But then sometimes they're like, sometimes I'm a good kid. So it's really helping build that self-esteem. So if you notice superheroes come up or they draw it, that's usually what the theme could be. Or it could mean that they need nurturance, they need saving, they want to be the one to save. So it could be that theme too. Those are really common ones with kids.
Yeah, do they have the inner strength? Or then do you ask, where have you learned that from? So you can kind of get an insight into their relationship with their parents or attachment in that way.
You could. Sometimes they may not have an answer for that. They may be like, I don't know where I learned it from.
Yeah.
But you can just kind of, yeah, ask different questions based on that.
Okay, so let me ask you this: when you just brought up something, when little kids go, I don't know, or all these things, how do you draw things out of them when they are being so?
Yeah. A lot of patience. I just usually if they're like that, but usually kids aren't really like that until they're about 9. That's when I start noticing like the apprehension, or so I don't
Okay.
know if it's still a response. It's still them communicating something to you that they may still feel uncomfortable. They may not know what the right answer is. So usually with like people pleaser kids, they want to tell me something, or they want to choose an activity they think I would like. And so I would just reflect that to them. So I would say, I wonder if you're worried you may not have the right answer to tell me, or I wonder if maybe you're not sure what to say and you need some more, you need me to help you explain that to you. And so I would just tell them there's nothing wrong with that. Sometimes I may just put it on myself, like, oh, I may have done a bad job explaining that to you. Help me help you understand it. Or so yeah, it's usually, I mean, sometimes it is kids are just being difficult. They may not want to be there. But just meet them where they're at. But usually it is like a fear of doing the wrong thing in counseling, because it's, mom's bringing me here, mom wants me to be fixed, and I want to do the right thing, and I want to please my counselor, or if you've used like a teacher, so it's yeah, there's usually a lot more that they're communicating there. Sometimes they're not trying to be difficult, they just are really anxious. So but I would document that.
Absolutely.
Yeah.
Very good. Yeah. And I think even the therapist has to overcome their anxiousness. I know when I'm working with children or whatever, and then I get to the point where I can't draw something out of them. And
Mm,
it's, you've got to overcome that anxiousness. I'm not
yeah.
able to do that too.
Yeah,
Thank
for
you for
sure.
that. Who else has a question or a scenario? Don't make me call somebody out.
I have something. I mean, I think
Okay.
so. So Natalie, what age group is the stuff that you talked about? What age group is it for?
We're focusing on kids and teens, but I've done these
Okay.
interventions with as young as 5, all the way up to, I've used it with adults too. So,
Okay.
they're focused towards kids, but they don't have to be, for sure.
Okay. Because I met with he's 15 on the Tuesday, and his mother wanted him to, talk to me because she's having some challenges at home. His father was murdered in a hit and run,
Oh,
and his father was never in his life even when he was alive. And then now she's in a relationship with a new guy, and they've been together almost 3 years. There's been some infidelity in their relationship, and the guy has moved in and trying to parent this kid. And so the 15-year-old, he's not doing well in school. He said to me, he said, I don't like when he parents me. I don't think he has the right to parent me, because it was always me and my mother all along when we were struggling. And now that she's brought her home and we're doing well, here comes this guy. And so he also told me that he doesn't like therapy. And his mom told him to come, and I asked him, I said, well, why do you think your mom wanted you to talk to me? And he said, well, because of my grades, and I'm getting Fs, and I'm not doing my chores, and they think I'm being disrespectful. And that's when he told me he doesn't like this guy parenting him. He doesn't think the guy has a right to parent him. And he said he doesn't want to come back because he doesn't think he needs it. And he likes talking to his aunt. But his mother, I think she wants him to come back. So how would you, I don't even know if this falls into the category of someone you would.
yeah.
Okay.
Yeah. What I'm noticing just from you telling me a story, there's 2 big themes that he is probably struggling with. One is grief, the
Mhm.
loss of, just the loss of not having a relationship with dad, grief of what could have been, grief of then, even though he didn't know dad died, grief of having that one-on-one time with mom now that this guy's moved in. And then
Yeah.
on top of that, there's a huge power control theme. He feels powerless. This
Yeah.
guy that he didn't want in his life is now telling him what to do. So he wants to overly have control now. So it's going to be, I'm not going to do my schoolwork. I don't want to be in therapy. I don't want to help, because he feels powerless. So that's his way of making order
Mhm.
to his world, helping him feel like he's got some feet on the ground, that he can make choices. So that's something I would probably do with him, is just help him grow, know what his choices are in life, letting him know that he has things he can control, even
Mhm.
though it feels out of his control. So we could do the circle of control. I would tell him,
Okay.
these are things that are common for us to, I don't know if you've done the circle of control before.
I have not.
Yeah, it's really, you just draw a circle and then you draw a little circle in the middle. Kind of looks like a fried egg, if I'm describing the
Oh,
picture.
okay.
And then on the outside of the small circle, we're gonna say what feels out of control for you. So you could write down, I've got to go to school. I have
Mm,
this guy living in my house now. Um, I'm only 15, so there's only so many choices a 15-year-old can make. Their life is really dictated. But then you
yeah.
would help them see, what do you have control over? Well, I have
Okay.
control over my thoughts. I have control over my future. You could
Mm,
really hone in on like his dreams and his ambitions. Like, what
okay.
is he passionate about? What does he want to do? Where does he see himself in 10 years?
Okay.
You could also do a timeline with him, and you could do have him do his life and then also do his future life. Like, I've had them, what year do you think you're gonna pass away? So it could be like, well, when I'm 80, so then we draw the time like 2080 or however old he is. And then
Mhm.
they get to be imaginative and creative and come up with what they want their future self to look like. So
Okay.
at this age, I'm going to go get my own apartment. At this age, I'm going to go to college and study this. And then with the current and past history, I have them write out both good and bad memories. So I'd have them write positive memories on the top and negative on the bottom.
Okay.
Um, and yeah, that's a good one to help. The future part really helps them. They get to be creative. They get to come up with it. It's not mom
Mhm.
in the room telling them, you need to be a
What to do.
doctor. Like, it's,
Yeah.
they get to be the imaginative one. And so yeah, especially when
That
there's oh, sorry, yeah.
no, I was going to say that I like what you that thing you just mentioned about the timeline, because in talking to him, he talked about how he loves playing baseball, loves playing baseball, and he told me he wants to be rich. He wants to retire his mom because she's worked like really hard, and he wants to play baseball. And there's something else he does, but baseball is like a huge part of his life. He's really good at it. He had an injury, he's recovering from it, and so he wants to continue to do that. So yeah, that timeline thing sounds like it would be a good idea for him to
Yeah.
just like continue using his imagination to explore that, like what that would look like. And maybe it might even give him something to look forward to, right?
Of course, that he knows I'm not going to be 15 forever,
Mhm. Mhm.
even though it feels like this right now. I've got things ahead of me. I can make changes to my world one day. And he sounds like such a good kid. Like, the fact that he's thinking
Yeah.
about his mom and giving back to her, I would just hone in on that and just
Okay.
reflect that to him. Like, wow,
Okay.
you are in such difficult situation. Just really empathize with him so that he feels
Yeah.
understood. Um, and yeah, help him get some power back to his world. Help him see that he does have choices, even though they're very minimal at 15.
Right.
Even just
Right.
empathizing with that, like, they just want. I don't think they're expecting you to understand, or they're
Mhm.
not expecting you to really get it. They're just thinking you're there to fix them, or reprimand them about their grades. And no one's going to want to go to a counselor if that's what happens. And so just showing him that you're his advocate, like, you're not necessarily in mom's wheelhouse, you're really in his. And so
Yeah, it's interesting you say that, because when I started, because his mom was sitting with him initially, and he was what a teenager would be, right? A teenager may not want to open up when their mother's sitting there. And so he was kind of like gun shy, and he's a good looking kid. And he was playing with his curly hair, and he was giving me like sort of brief answers. And I don't know, I forget the question I asked him, but he said he wanted to be alone. And so his mom was like, okay, let me put the chicken away. And she left. And as soon as his mother left, that's when I started. He was like, I said, is there anything I can tell you about me? Do you have any questions for me that might make you feel more comfortable? And he was like, so, what school do you go to? Why did you want to become a counselor? He asked me a few questions, and then one of the questions he asked me segued into me asking him something, and that's when he started telling me about his feelings about this guy in the home, and how one of the other things he said was he gets very upset because now his mother takes the fiance side and doesn't take his side. And so he opened up quite a bit about that dynamic in the household. Like, wow.
That's huge. Yeah.
Yeah. So
Yeah, it does make a difference when they're not sitting right next to their mom on the
yeah.
couch for sure. And it sounds like he's very relational. Like he
Mhm.
wanted to know about you and asked you questions. Not
Mhm.
every teen does that. Usually they're very egocentric and
Mhm.
for them to think about what to ask you. So he's got some really good skills there just as a person. He sounds like a really good client. Maybe hard
I
at
hope he
first,
comes
but
back. I hope he comes back.
yes, yeah.
We'll see. Thank you, though.
Awesome.
Appreciate
Yeah.
that.
All right. Who else has a question? Anybody else?
I was trying to wait and see if somebody else had one before I came
Oh,
back
okay.
on.
No, go for it, Camille.
Okay, so this minor I've been seeing since the end of January. And so he's a force. I think I've talked about this before. So he's being forced to come to therapy. And what they see at home is totally different than how he presents in, well, I won't say totally different. He's still pretty like, he doesn't want to come to therapy. He's very adamant about that. But he'll talk if, we play games or, and I've been doing some of the get to know you interventions from stage 1. I haven't seen him for 2 weeks, so I don't know what he'll present with tomorrow. I see him on Saturdays, but overall, when I had the parent meeting about a month ago, they didn't see a change. He didn't see it. He said he doesn't feel any different. And so I guess I'm just wondering, how long do we stay in these stages to try to get there? And when is it,
Yeah.
time to say something like, okay, well, maybe this isn't the right time for therapy, as he doesn't want to be here. He's not, like, I know some things about him, but I don't know a ton because he's not, and something. I mean, the last time I saw him, he was a little bit more like, I think he enjoyed the activity I had for him to get to know him. So I think he enjoyed that, but I don't know. I'm kind of stuck on him.
Yeah. That sounds like everyone feels really frustrated right now. Like you're not seeing change. He's not seeing change. Mom isn't seeing change. And yeah, it's a hard one to know when is it time to refer out? Maybe when is it time to pause, or do we just keep doing what we're doing? And honestly, that question is something I would have for your supervisor, because every situation is so different. And I've been there too, where I just have felt really stuck and not really sure what to do. I would say there isn't a timeline necessarily on every stage, especially the relationship building one. I would take as much time as you need for that. Even if it was January when he started, he may just need some more of that. And I think these activities of learning his inner world could be helpful too. I feel like I had something else to say and I just lost it. Yeah, I feel like something you could do is whatever behaviors he came in with, I would just document that, get a baseline, whatever it is. Maybe it's like he's having outbursts 5 days a week and they're really bad. I would just record that and then check in every month. Maybe he's having 5 still a week, but they're not as big, or maybe he's only having 4 now. And so sometimes parents, it's hard for them to see change when the problem isn't completely gone. And clients too. I do this with all my adult clients too. I want to get a number, like how often a week do you feel like you have these scary thoughts? How often a week do you have an anxiety or panic attack? And so I'm getting this baseline, because what doesn't happen usually is after we meet for 3 months, it's not gone. Like they're still struggling with it. And then they can get discouraged and they feel like they haven't done any work. But rather, I want to focus on If it has decreased at all, even a small amount, I really want to focus on that and let them know there's progress happening, even though it doesn't feel like it. Then I show them that, and that usually helps them be like, oh yeah. And then I review treatment plans a lot and just go back to our initial goals. And then they may notice something like, usually it's either like, I forgot how bad it was when I started counseling. And then they're now like, yeah, I feel a lot more in control. I feel a lot more like I have a lot more tools. And but they wouldn't have ever thought about that. So that's why that part is so important to really hone in on. But yeah, if you do feel just like chronically stuck, or you feel like he just isn't wanting to be there, then that could be, and this isn't me telling you, I'm not your supervisor, so I don't know exactly everything, but
Right. I got you.
yeah, it could be that he needs a referral. Maybe he'd benefit from a male therapist. Maybe it's just not time. Maybe there's unrealistic goals set by mom and dad. So it's just looking at those things like, is what we're working on, is it realistic, or do we need to have smaller goals right now? Because sometimes everyone's going to feel defeated if we're working towards something that's just not practical or realistic. So it's maybe going through goals. So what's a small change that could happen, and that when we break it down to smaller changes, then it feels like it's more doable. For sure, for kids. So those are my suggestions that you could do.
Okay.
That is hard. Yeah, I've been there with a few of them. It is.
That happens with adults too.
Yeah.
I love what you said about being too close to it, because just think of somebody. I've been on a diet thing, so I've lost some weight. So, but the thing is, you don't really see the difference in you because you see the change, but somebody else who hasn't seen you in quite a while can say, wow, you're looking, different. So it is being close to it and living with it can be the difference between progress.
Yeah.
So that's very good. I like that.
Yeah, that's even a good analogy. You could talk to him about Camille. Like if he's into like lifting, like you could be doing that for weeks and you're just sore every day and you're not seeing the benefits, but all of a sudden you can carry in more groceries even though you don't see the change. Like just focusing on the small differences for sure is really what can help them get through the frustrated part.
Okay, thank you.
It's very good. Thank you. Anybody else? Well, excellent job as usual, Natalie, I appreciate that. So thanks to everybody else for being on. I'm going to stop this recording.